behaviors and then in their school functioning. I want to point this out again to say that already at this very young age, these symptoms are causing problems for children across multiple relationships and across multiple domains. And we can only imagine what that will be like as the child continues and goes into regular school. Now here is looking at all of the children in our study who were diagnosed with an anxiety disorder. 15% of them had been referred by their pediatrician for some kind of mental health evaluation. So the vast majority were not recognized at all. Now 33% of the parents whose children hadn't been referred were already concerned about their child and felt that their child had a problem or needed some kind of help. So there is an opportunity for, particularly for pediatricians, to talk with parents about their concerns because they may be able to identify problems that wouldn't come up in the regular visit. We do want to note, though, that a full half of the parents weren't concerned about their children. So this is another aspect of education and understanding about what is expected and what might be clinically significant in young children. Now, this is to ask the question, well, okay, so they have these problems as preschoolers, but do they persist? Are they going to continue to have problems, or are they going to grow out of these symptoms or these disorders? And I'm just going to show you one slide from that, and this is from our follow-up study. So this is children who had an anxiety disorder as preschoolers, whether or not 4 years later, when they were 6 to 9 years old, they had met criteria for any psychiatric disorder. And what's intriguing is that we don't find persistence to anxiety disorders, but where we see persistence is very strongly to depression and then to oppositional defiant disorder. And what's interesting about that is we think that ODD may be sort of related to depression in early childhood and is related to anger dysregulation and mood dysregulation rather than just a behavioral disorder. This is really a snippet into an area that we're just starting to analyze these data, but clearly it's not a simple story that if a child has anxiety, they're going to have anxiety. We need to really understand what these things may develop into. Now I'm going to briefly turn to another aspect of this question of whether or not anxiety disorders in preschoolers are similar. And this is showing you some early data from new work that we're doing, looking at how early childhood behavior and anxiety specifically relates to dysfunctions in the neural circuitry of the brain. So the first thing I'm going to talk about is a fMRI study that we did where we took children who were diagnosed as preschoolers with an anxiety disorder, and then 4 years later we did a functional MRI scan to look to see if their activation in their brains was different than kids who didn't have an anxiety disorder as preschoolers. Now, similar work is now being done in adults and adolescents with anxiety disorders, and there's two different things that have been found. One, that people with an anxiety disorder have what we call an attention-orienting and appraisal bias. So basically that means that they're looking for threat, so they're kind of scanning the environment for threat, and that they're going to find threat in many places that normal people wouldn't. And so an example would be walking down the street and there's a toy snake on the ground. Now, someone who didn't have an anxiety disorder might have an immediate reaction of a snake, and there's, oh, it's a rubber snake. A person with anxiety disorder may see the snake, and even if they realize that it's a toy snake, all of the hyperarousal and that reaction and that fear, focusing on that fear state, kind of gets turned on and can't turn off. So that's something that's seen in older people. We wanted to know if we saw something similar in young children. The other interesting thing that's starting to be looked at in older people with anxiety disorders is there also seems to be a social information processing dysfunction in people with anxiety disorders. So one thought is that people with anxiety have trouble interpreting ambiguity. So sort of think, is this a scary face or is that a happy face? Is this person scared? Is this person surprised? The other thing, there's been some really intriguing evidence that people with anxiety might hyperreact even to happy faces. So it's not just threat. And again, maybe that has to do with having trouble with attributing specific emotions and understanding of social context. So we did this study with 26 subjects. When they'd been diagnosed with an anxiety disorder, the children were about 2 to 3 years old on mean. And when we did the fMRI scan, they were a mean age of 7. Now, we picked the kids based on their preschool anxiety disorder status. And in fact, most of the children didn't still meet criteria for an anxiety disorder 4 years later, although almost all of them were still impaired in their functioning in some way. So what we did, again, I won't go into the details of the study design, but we showed them a series of faces with different emotional expressions. And this is a paradigm that has been used with older people, both adolescents and adults, to look at whether people with anxiety look at different emotional expressions on faces differently. I'm just going to focus on the activation differences that we found in one part of the brain, and that's in the amygdala, which is the core part of the limbic system, which is where we have both threat detection, so the snake detection rapidly goes there, but the amygdala is also very involved in determining the emotional states of other people and analyzing facial expressions. So we found that indeed children who'd been diagnosed as preschoolers with an anxiety disorder had greater activation to all the faces in the amygdala. That is a finding that's similar to what has been found with older people. But we wanted to ask the question, is that due to the fact that they're anxious right now? It's not really something to do with what they had back then, but rather a reflection of their current state of anxiety or depression. So we then controlled for the children in our models for the current level of anxiety and depression, and what we found on the right side is that we still had that hyperactivation in the amygdala. Now, that doesn't definitively tell us it was there when they were preschoolers, but it gives us a hint that we're talking about a pattern of neural reactivity that may have been going on when they were very young children and is certainly persisting. Now, we also found that this really wasn't just to all the faces, but that children with anxiety responded with greater activation in the amygdala to 2 different types of faces. So the anxious kids in the controls had the same amount of activation to neutral faces and to angry faces. But the children with anxiety had much greater activation to fearful faces and, interestingly, greater activation to happy faces. Now, this story makes sense. I mean, it makes sense that if a person without anxiety saw an angry face, that would be appropriate to have a threat response to that because you want to know, should you run? Are you in danger? But what we see is that children with anxiety disorders have that same kind of reaction when they see another person who's afraid. But interestingly, and this may have to do with the social ambiguity question, also to happy faces. Maybe they're having trouble categorizing threat or not threat. Now, that's one way that we're trying to look at these questions. Another way is that we're looking at the visual scan paths of young children. Now, this is in a new study we're doing, again, with preschoolers with anxiety disorders who are 2 to 5 years old. And this is a really exciting new technology. This is what the monitor looks like, and they're infrared cameras down here on the monitor. And the children just sit about a foot away from the monitor and just look at the monitor, and we show them various pictures. I put here that we call it playing the statue game because you have to see how you can help a 2-year-old stay quiet and look at the picture for about 4 minutes. They can sit on their mom's lap if need be. And what we want to find out is whether children with anxiety disorders look at various kind of pictures and stimuli differently than people without anxiety. So here I'm going to show you a